Hello, everyone. Thank you for joining us. My name is Kara Jackman, and I'm excited to sit down with Becky Abbott from the National Foundation for Ectodermal Dysplasias to discuss the Ensuring Lasting Smiles Act. I want to start by introducing Becky. Becky has a MPH and has joined the staff as Director of Research and Treatment Advocacy with the National Foundation for Ectodermal Dysplasia. Becky received her master's in public health from Benedictine University. She has experience as a sales manager, public health consultant, and rare disease advocate. Because of her personal experience with ectodermal dysplasia, she is a very active member of this organization as a volunteer and now as Director of Research and Treatment. She lives in Wisconsin with her husband, Detective Thomas Abbott, and their two children, Aiden and Ryder. She has experienced firsthand challenges in getting Aiden, who was affected by X-linked hypohidrotic ectodermal dysplasia, dental care. As an active advocate, Becky and her family share their personal experiences and insurance struggles to empower other families on their journey. They regularly meet with legislators on Capitol Hill and locally to discuss legislation that impacts the rare disease community. With that, I'm going to jump into some questions about the Ensuring Lasting Smiles Act, also known as ELSA. So Becky, could you tell us a bit about what ELSA is?
Sure, I'd be happy to. So ELSA, which is also known as the Ensuring Lasting Smiles Act, is also number HR 1916 in the U.S. House of Representatives, as well as bill number S754 in the U.S. Senate, is federal legislation that was reintroduced on March 16th, 2021 with strong bipartisan support. ELSA is broadly written based on the 50 state statutes that would require insurers to offer coverage for the medically necessary repair of congenital anomalies. The Ensuring Lasting Smiles Act will ensure that private, group, and individual health plans do not deny or delay medically necessary treatments of congenital anomalies. The Ensuring Lasting Smiles Act will also put the determination of medical necessity into the hands of the treating physician instead of insurance companies, which is very important. The treating physician makes that determination. As of right now, we have 317 co-sponsors in the U.S. House of Representatives. ELSA was passed in the U.S. House of Representatives on April 4th, so we're very excited about that by a 310 to 110 vote. And as of right now, there are 40 co-sponsors in the U.S. Senate.
Awesome. That's wonderful to hear. Why is this act so important?
So this legislation, as I had mentioned before, would require that all private group and individual health insurance plans provide coverage for the necessary items and services that are needed to repair congenital anomalies. And as you can imagine, that there are a whole host of different congenital anomalies that are represented under this legislation. About 4% of children in the United States are born with congenital anomalies, and it affects the way they look, develop, and function. Many of those who are born with congenital anomalies suffer from different defects, such as oral defects. I'll just name a couple of them: cleft lip, cleft palate, craniofacial, enamel, hypodontia, some skeletal vision, as well as hearing defects. And then also, I was just going to mention that individuals who do not receive treatment in a timely manner can go on to face very potentially long-term physical and psychological injuries, which could affect them for the rest of their life. So we feel that it's very important that insurance companies cover the treatment of these congenital anomalies so that there isn't secondary health issues that come along after the first issue isn't treated. So of course, as everybody knows, the problem is that most group and individual health plans, they include coverages for congenital anomalies. However, they routinely deny or delay the coverage of those treatments for congenital anomalies. And because this happens often, then the families are left with the burden of having to pay for it out of pocket. And as I'm sure most of you also know, it's very hard for families to come up with thousands of dollars out of pocket to be able to pay for those coverages. Most oftentimes families can't pay for those services. So of course, the solution would be to get the Ensuring Lasting Smiles Act passed so that it would cover the congenital anomalies, the repair of the congenital anomalies, and then it would improve the health of countless Americans.
Awesome. Thank you so much for that explanation. Could you share with us who would benefit from or who is affected or would be affected by this piece of legislation?
Sure. So ELSA was broadly written to include all congenital anomalies as long as the services or treatments are medically necessary. So while our group advocates, the ectodermal dysplasia group advocates for dental or oral defects, this does cover all congenital anomalies. So in the United States, about 4% of children are born with a congenital anomaly. So the big question is, what will ELSA do? ELSA will ensure that private group and insurance health plans do not deny or delay medically necessary treatments of congenital anomalies. And just some of the congenital anomalies that would be included would be the ones I mentioned before, the oral defects, such as cleft lip and palate, craniofacial, hypodontia, enamel, skeletal, vision, and hearing defects. And the bottom line is any medically diagnosed congenital anomaly that requires medically necessary treatments would benefit from the passage of the Ensuring Lasting Smiles Act. And that's why we have over 70 plus organizations representing a broad group of different congenital anomalies that are advocating for the Ensuring Lasting Smiles Act.
Thank you. That's very impressive. How can families help raise awareness about the dental care needs of craniofacial patients and others that may benefit from this act?
Yeah, so I believe that your personal and unique story is the most powerful tool that you have in your toolbox to try to raise awareness and make change. Legislators want to hear your stories. They want to hear from the patient's perspective. And of course, you're the best person to share your own story, or if you're a provider, to share your patient's story. We have, as patient advocates, the opportunity to change the lives not only of ourselves and our loved ones, but all those living with congenital anomalies. So when our family is advocating on Capitol Hill or in virtual meetings, we understand that we're part of a much bigger team. And while we're advocating for my son, we're also advocating on behalf of all those born with congenital anomalies. Personal stories can help make a legislator decide whether or not to co-sponsor or support legislation. Two of our bill sponsors, Senator Baldwin and Senator Ernst, and many, many other legislators co-sponsored just because they heard one individual or one family story. So you may think that your story is not important, but in all actuality, just one story could make all the difference to get support in your state. Each legislator is important. We have some advocates that say, well, you already have 40 co-sponsors, what is one more going to do? But every single co-sponsor or every single legislator who supports ELSA will move ELSA forward. If legislators don't hear from you, they won't know how important this legislation is to you or your patients. The first few times we went to Capitol Hill, no one had ever heard of ectodermal dysplasias or that children were being born with these congenital anomalies or missing teeth, and that they didn't even know that insurers wouldn't provide this coverage. So it's up to us to share our stories so that legislators understand exactly how important this legislation is. I just always like to add, anyone can advocate. My son has been advocating since about the age of 10. There's no experience necessary. And I would encourage anybody who is willing to share their story to advocate.
Thank you so much, Becky. We at CCA want to keep our families informed about all things that may affect them in their care and their treatment for the individual or child in their life that has craniofacial condition. But by way of disclaimer, we do want to share that we do not advocate in any form of legislation, as we are a nonprofit, a 501c3. So we only hope to keep our families educated and informed about all of these wonderful things that are happening out there in the world. We applaud your work and your family's work to get this in front of more eyes and in front of and on the desks of legislators in Washington, D.C. Thank you so much.
Yeah, thank you so much for inviting me. I left my email address here if anybody has any questions, and I really appreciate you allowing me to share our story, and hopefully this legislation will pass. And with all of us working together, anybody who's born with congenital anomalies can receive the medically necessary treatments they need and deserve. So thank you for having me.
Thank you so much. Well, have a great day.